I'm Jenny Backus, Acting Assistant Secretary for Public Affairs right here at HHS, and welcome to our 7th web chat on health reform. We know that some of the details of the Affordable Care Act can be confusing, so we're here to answer your questions. Did you know that under the Affordable Care Act, starting in September of this year, insurers are required to allow young adults to stay on their parents' health care plan until they're 26? This means that 1.2 million young Americans will be able to keep their coverage under their parents' plan. And today we're going to answer your questions about this important early benefit of the health insurance reform legislation and what it means for young adults and what it means for families. We've invited you all to submit your own questions, and we've received thousands of them, especially on this topic. It's a good benefit. A lot of people don't know about it. If you want to ask a question during our chat, we want to hear from you. We're taking questions from Twitter. So send us a tweet, and our handle is @HHSGOV, or you can always email us, and that address is healthreform@hhs.gov. We've got folks standing by to pass the questions on out to me. If you can keep your questions brief, we'll try to get as many answered as possible today, and we may have to paraphrase a little bit. And if we don't get to your question today, check out our website, healthreform.gov, and you just might find your answer there, because every day we try to address your most frequently asked questions. Okay, young adults ages 18 to 29 are currently the most underinsured group of people in this country. And today we have 2 expert panelists here in the studio to break down just how the Affordable Care Act can help change that. Joining us are Kathleen Sebelius, Secretary of Health and Human Services, and Heather Smith, President of Rock the Vote. Thank you both for joining us.
Thank you.
Secretary Sebelius, you have 2 sons, a little past college age, but as a parent, what does this benefit mean for parents and young adults?
Well, Jenny, when my boys graduated from college, one finished in 2003 and the younger one finished in 2006, we were in the situation that a lot of parents face, where the kids had health coverage under our plan, but at college they were no longer eligible to stay on the family plan. So we had to think about graduation being a good deal, but then finding them health insurance right away, because neither of them were going into a job where insurance coverage was part of the package. So we shopped on the open market. The good news for us is they were healthy. We had some resources to help them navigate. I'm a former insurance commissioner, so I actually could make my way through the Byzantine process, and we got coverage. But lots of folks are not in that situation, and this new provision in the Affordable Care Act says if you're on a family plan and your kids are currently covered in your family plan, that they can stay on until their 26th birthday. It's not just for kids who are graduated from college, but people who may be heading into the job market, facing a job without insurance coverage, don't have access to affordable insurance. And it's a good deal for young adults, and I think it's a good deal overall for the health of the nation. I mean, we'll have some healthier folks in the long run.
Now, Heather, your group represents a lot of people. They call themselves sometimes invincible, or they don't need health care. Why is this benefit so important for the people that you represent?
Yeah, so Rock the Vote, we work with young people all around this country. We have a couple million members, and we went out to them and said, what are your top issues? What do you care most about? And, you know, jobs, economy, and healthcare are always at the top. So when this healthcare debate started, we wanted to make sure that it was a good deal for young people, it was a good deal for young adults. And we fought really hard, and young people all around the country were engaged in this debate to make sure that this age 26 provision, this dependent care provision, really passed. Because, well, you know, the rumors are, and the conventional wisdom is, they're invincible. They don't care. But the truth is, they're the most uninsured age group in this country. It's about 30% of them with no health care insurance. They need insurance. Nearly half of them are struggling to pay medical bills right now. 1 in 6 have some chronic disease. But the options are slim. You know, they're entering the workforce and not getting health insurance offered as as a benefit to their jobs, if they're lucky enough to find a job right now. And so we want to make sure that when they graduate from college, or perhaps when they're just entering the workforce, as they're coming of age, these young people can actually stay on their parents' plan, have a really good option to help insure 1.2 million more young people. So really excited about this provision and want to spread the word.
Now, you mentioned you're a former insurance commissioner. what does it mean to add young people into the insurance pool for those of us who are not insurance commissioners?
Well, if you think about it, insurance is really about sharing and spreading the risk. So if you're in a health insurance market, what you want is some people who may get sick, and all of us may be, one accident, one disease away from needing a lot of health care, and people who are healthy. If you only have sick people, prices are going to skyrocket, and often that's what folks find themselves in. So having younger Americans, having 26-year-old and under in a health insurance pool is a great idea for costs overall. It brings down the age of some of the folks who are in the plan. It actually helps spread the risk, and I think by and large, younger folks are healthier than those who are. You're healthier at 25 than you're likely to be at 55, than you're likely to be at 75. So having 25-year-olds as part of an insurance plan, just based on the numbers, is a good deal for the overall cost of the health plan.
And how were young people getting care before? I mean...
Yeah, no, I can't emphasize this enough. This is a big deal for young adults. This type of provision to be able to stay on your parents' plan until age 26 is something that's never been available before, except in a handful of states. And so it's an option for young people that they didn't have before. We like to say at Rock the Vote that before we had bankruptcy or uninsured, not a good option, and now we have this, and it's a great deal for young adults.
Now, you're talking about great deals, and I've got some great questions here from around the country. But before I get there, because I think Tracy has a really good question about companies and how and when they're asking people to give care. I want to talk to you a little bit before we do. Just quickly ask you, you sent a letter, and you and the President and Nancy Ann at the White House, Nancy Ann DeParle at the White House, did a lot of communicating with the insurance companies to, this benefit actually was supposed to go into effect in September, right? Mm-hmm. And you've done some asking. Can you talk a little bit about that?
Well, the law is written so that the benefits hit 6 months after the President signed the bill. March 23rd, September 23rd is the mandatory date, and all companies will have to have a open enrollment, a sign-up period on September 23rd and after, during the month of September, so young adults can, if they're have been disenrolled, be able to re-enroll in the plan. But the great news is that we figured this is one, why wait till September? Why have kids graduate from college in May and maybe spend 3 or 4 months without coverage? Why not see if the companies would work with us and actually look at early implementation? And the response has been very good. We have about 65 of the major insurance companies, all the big health insurance companies across the country said, we think this is a good idea too. We're going to open up our plans much earlier this May, so that if you are looking at a college graduation, you don't have to be uninsured and then reinsured. And also if your birthday hits, a lot of states you're off the plan at 21 or 22. There's a date certain. So again, your birthday won't mean you're uninsured until you hit your 26th birthday. And I think this is a very good deal for we think over 1 million young adults in this country can keep or get coverage back at an affordable, available level.
And that actually helps with jobs, right? I mean, if they're looking for jobs, they don't have to worry about health care. I mean, it ties in with the economy.
That's
okay.
Right.
Tracy, sorry, I don't mean to step on Tracy's question here. Tracy said, I've heard that several companies will adhere to the law requiring that dependents be offered coverage up to 26. However, they are planning on charging an extra surcharge for that cover. Is that the norm? Secretary?
Well, Tracy, the law makes it very specific that you can't single out this group of, 21 to 26-year-olds and have some special extra charge for them. You can't medically underwrite them, have different set of rules than you would have for everybody else in a plan. But clearly, if we're covering more people, companies can look at, what that will cost overall, what the balance is. But the good news is that across the country, as people who look at these numbers and trends have identified, we think it will be less than 1% to actually insure 1 million to additional kids, that the cost of enlarging the pool and covering these young adults into several years into the future has a very minimal overall cost driver in health insurance, and that's great news.
Okay. Heather.
Yes.
Tina wants to know, and I don't know where Tina's from, but Tina wants to know, can my stepchildren up to the age of 26 be covered under my plan?
Yeah. If your current plan covers your stepchildren as dependents, then you can continue to have your stepchildren covered as dependents until their 26th birthday. So it's fairly simple. If you have a plan with dependent care coverage, then you can extend that until your children are aged, until their 26th birthday.
Which might be another reason why it's pretty easy for the insurers to
very simple
speed this thing
and
up.
there may be some kids who are 24 who were on their parents' plan, turned 21, and now are off, and they actually, stepchildren or children, can come back in at the open enrollment period. So it doesn't have to be the so-called continuous coverage.
Yeah.
You don't have to be covered this moment. But if you're eligible and if the company offers dependent care, then you could come back under the policy if that's a good option for you and your family.
Well, in fact, you just anticipated. I think this is a Twitter question. It's anonymous. That would take up a lot of Twitter characters. But it says, for a student age 23 that is currently under an individual student plan, will they be allowed to drop their student plan and apply as a dependent on their parents' plan? So it sounds like yes.
Yes.
Right.
Absolutely.
And can you, I think that's actually important. I didn't know this about the law, so to repeat again that if you used to be on your parents' plan, you're still in this age window, you can come back in and apply.
That's right. So, we talk a lot about college kids because a lot of college students are on a school-based plan and they use their kind of family coverage as a backup. But most of the insurance plans for employers right now, except, as Heather said, in a few states, say once you are no longer a full-time student, you are not eligible any longer for family coverage. So this fills that gap, but it also, if you've been off for a year or two but haven't reached your 26th birthday, this is available to you.
Okay, that's good. All right, next question is from Michelle. Are adult children covered until their 26th birthday or at the end of the year of their 26th birthday, i.e. almost 27th? I think that the tax treatment was just put out on the IRS on this, right?
Yes.
It's until you turn 26.
Okay, great. Rona from Iowa. Are adults who are under 26 but married eligible?
Yes. So easy.
Yes. This is like our easiest webcast ever.
No, but it's true. You can, you can go back on your parents' plan as a dependent. You are covered. Your spouse or your children cannot, but marital status doesn't matter. So you're still a child. You're still under the age of 26. You are eligible.
All right. Kimberly, and either one of you, does a child have to be a full-time college student? Actually, Secretary, you talked about this. Maybe I'll go back to you. Does a child have to be a full-time college student to be covered?
No, you don't have to be in school at all. Oftentimes, Jenny, the way a lot of plans are written, you either reach a birthday, a date certain, 21, 22, or you can be full-time in school, and sometimes that extended the age past 21 or 22. But lots of folks weren't in either of those categories and might have been 24, 25. They are eligible. So it's anyone who is a child or qualifies as a child or stepchild up until their 26th birthday. You don't have to be in school. You don't have to qualify any longer as a full-time student. It's just the birthday that extends the policy.
Wow.
Yeah.
Okay.
I think it's particularly timely right now to talk about college students because, of course, it's graduation time. There's about 3 million young people who graduate every year from college, and about 2/3 are on their parents' health care plans. Now, they won't all graduate this May, but throughout the year. But it's graduation time. They're graduating, and so parents right now and young people themselves are trying to figure out what the next step is. And that's why I even think it's more exciting that these insurance companies, all 65 of them so far, have offered to start the enrollment earlier. I know Rock the Vote and our colleagues and other youth organizations have been sending letters to the insurance companies too, saying, it's a good deal for them. They don't have to go through the administrative costs of dropping someone and adding them back on. And for young people and our constituents, they get to continue being covered.
So, well, we're also reaching out, Heather said, insurance companies. Lots of people in a workforce, the parents may have the so-called self-insured plan, where it's really employers purchasing the coverage. And we're also reaching out to major employers to say, the law applies to you come September. But in the meantime, think about, talking to your plan manager and seeing if this would be available also to governors. This is not just for the private sector, it's also the public sector. So lots of state employees may be eligible, lots of city employees may be eligible to keep their kids on. So we're trying to see how fast we could get this very important benefit in place for as many of those 1.2 million as possible.
Well, you also mentioned college graduation, but high school graduate too, right? If you're going to go out into the workforce or you're not going to college for a while.
Right.
Okay, so
absolutely.
Lots of people, May and June, big months for people
big
from
months,
graduating. Okay, let's keep going on some questions. Kathy, my son is 21 years old and I want him to continue to get coverage through my insurance. Currently, he's a full-time student until mid-May. What if my insurance company drops his coverage in May or June?
Well, first I would check with your insurance company because it may be that that's one of the companies who's already said we're going to open this up. At the very least, the law will apply to your son in September, and companies will have to have open enrollment periods, and you will be able to re-enroll your son. We would strongly urge that you think about, getting an individual policy for a couple of months so that you don't take the chance that something terrible, God forbid, happens, but an accident or something in those intervening months, being uninsured could be debt for the rest of your life. So that's a pretty dangerous place to be. But we're hoping that more and more companies and business owners will step up. So check on your own individual policy, check on your own individual plan, and then at the very least there should be an open enrollment period in September.
Great. Another question that just came in from the internet from Patricia. My daughter turned 25 this year and was on my insurance. My employer stated she could no longer continue on my insurance. But with this new benefit, can I put her back in September when it goes into effect?
Yes.
Okay.
That's a good.
Yeah, there you go.
I like these. Yes.
I know.
You just talked about, Heather, this one to you, but Secretary, you were talking about it too. Bill from Montana. Does the adult child have to purchase the individual policy, or how does it work?
No, this is a no.
Yeah.
All right.
But there's a good answer. It's really the parent can add them onto their plan as a dependent, assuming they have a health care plan with dependent coverage. And so they'll be on their family's plan. They don't have to go out into the marketplace and buy an individual plan.
And Jenny, the way a lot of plans work, you have a choice as a worker often to cover yourself only, cover yourself and your spouse, or cover yourself and dependents. So those options typically are available in companies where dependent coverage is offered, and that's really what we're talking about. Typically you don't add up the number. You may cover one child, you may cover two or three. This then becomes part of those children who are eligible to be covered.
Well, actually, that sort of anticipates this question from Cindy from Arizona. What if my insurance doesn't provide dependent coverage? You just have to...
Well, there's no mandate that says dependent coverage has to be offered. So this is a benefit for those companies or those employers who already have dependent coverage available. And it just sort of redefines what dependent means. It extends the age for a dependent. Now, having that conversation as an employee with your employer saying, wouldn't this be a good idea, might be something that people take a look at. But this does not mandate that the companies have to offer coverage for families.
Okay. Becky from Arkansas. How can I find out if my insurance carrier is going to take steps to make this change earlier than the September 23rd implementation date?
Yeah, so there's a lot of talk about this, but obviously the process is important too. And it's quite simple. You should directly call your insurance company and find out if they're going to do it, and if they can, and if they say no, you should ask them to do it. We would encourage you. But you can also check out the website, the hhs.gov website, and there's a list there under the FAQs and the fact sheets that has all the insurance companies to date who've signed up for this. So either go to the hhs.gov website and check out the list, or call your insurance company directly and just ask.
Along that line, too, you can go to hhs.gov. You can also go to healthreform.gov, too, and there's a little blog post up there that lists out all the companies. And we are trying to add companies. We want to call out companies that are coming on early. We're trying to add them to the list. And also, make sure that you talk to your state and local insurance commissioner if you're getting questions or you're not sure you're hearing the right thing. And I want to ask you a little bit, I've got a couple more Twitter questions, but I want to quickly ask you, again, you're a former insurance commissioner. Last week we had, 2 weeks ago, we had Jay Angoff from our Office of Insurance Oversight. What are some things or places that people can do, and what are you doing to help consumers, the sort of consumer information process? That's sort of a building process in this bill.
You bet. People have a lot of questions, and we certainly understand that. And this bill is pretty comprehensive. It has a lot of benefits in it that we want to make sure that Americans know about. You know, we're talking now about parents who may have adult children, but they're features that are good news for seniors. Small business owners are available to get tax credits. I mean, there's lots of moving parts of the puzzle. So we have a website, healthreform.gov, that has information. Later this summer, midsummer, we hope to have a very robust web portal, so people will be able to come on to the web from any part of the country and know what their insurance market looks like, what kind of choices they have, what sort of prices are being charged. They'll have a lot of information in a question and answer form about the new bill. We'll have a call center where people will be able to call individually and get specific questions answered. We kind of want to be America's help desk. But in the meantime, there are also insurance commissioners' offices in every state in the country and the District of Columbia. They are the oversight over the insurance industry, and a lot of this information is available right now through an insurance commissioner in your home state, in the district. And we'd urge folks to check on, you know, the benefits, the ideas. If you get a quote or a price about something that seems like it may not be on the up and up, call your insurance commissioner, because that's part of what they do. They're there to protect consumers.
Okay, and we'll also have more information about that as we build up the website in coming days. I don't want to deny our folks that have been sending in questions. Jessica from Washington. Will premiums for everyone skyrocket as a result of adding these young adults to the market? I think we talked a little bit about this earlier, but can we address those questions?
Yeah, perhaps that's best for you to take.
Well, I think that covering more people may increase the cost somewhat, but I think overall you could make a pretty good argument that it also may help to balance the costs, because you would bring a younger, healthier population in. And as I say, right now, in most dependent coverage, you don't really get charged per child. There is a component that gets figured out where if you add children to the package, but children, by and large, and certainly young adults, are much cheaper than people as they get older. They just have fewer health problems. Some have chronic diseases, some have serious health problems, but fewer have health problems. So this is a big population of uninsured young adults, but who are by and large significantly healthier than their parents or their grandparents are. And I think it's just exactly the population you want to be in insurance pools, help to balance that risk.
And before, those young people were walking into emergency rooms or getting really, really sick, and that would be driving costs up.
That bill was driving costs up for both young people and for those who were insured. So,
well, it's estimated, Jenny, that for the uninsured Americans, for the 45, 46 million Americans without coverage, everybody who bought his or her own health insurance or paid for health insurance as an employer, was paying about $1,000 per policy more to cover all the costs of people who had no coverage. So they would stay in a hospital. That adds to the hospital bills of those who can pay a bill. They would access a doctor but couldn't pay the bill, so they'd add to the bills. What we've had the numbers experts say is that adding these young adults should increase insurance premiums overall by less than 1%. That's a pretty good investment. So you get 1 million plus young adults covered, and less than 1% will be added to health premiums, and I think that's a great benefit.
Okay, well, we have 2 minutes left, so quickly do some closing thoughts. Heather, we've talked about this benefit. Is there other things that Rock the Vote really thinks are important inside this bill? Any other closing thoughts that you have for folks out there?
Well, just that, young people have been really engaged in participating, whether it's at the elections and then in this healthcare debate. We had over 500,000 young people actively participating with Rock the Vote this cycle in fighting for healthcare and that it be a good deal for young adults. So I'd like to thank them for their involvement. I think they've made this type of provision that really does directly address their needs possible. It's made it something that we can be up here talking about today. And if there are any questions from those young people out there watching, call us at Rock the Vote, email us at info@rockthevote. We'll take your questions and we'll help you through this process, because it was one thing to fight for it, but it's another thing to make sure you get the benefits of the engagement and the work that we just saw happen. And really thank you to you, Secretary, for pushing this provision and making sure people know about it and making it possible.
Secretary, you just sent a letter to Congress last night to the 4 bipartisan leaders talking about progress to date. This is 4th or 5th of your big initiatives. Can you give us a little quick implementation update?
Well, I think that implementation is going very well, and what it really means is we're trying to give consumers back some control over their own healthcare decisions, put healthcare decisions back in the hands of doctors and their patients, and over time lower the cost for everybody. So these steps along the way, small business owners this year are eligible for tax credit. So a number of them who have dropped insurance coverage in the last few years, we hope will come back into the market. We hope that they'll provide that health security for their employees, and the bill offers them some help. High-risk pool available for adults starting this summer. People who don't have any other option because they've been turned down or locked out of the insurance market will have some options to cover themselves in their chronic situations. Certainly this young adults benefit is huge for a lot of the young people, and as Heather said, who got engaged, who got involved, who really worked on health reform, and now are actually able to be beneficiaries of some of their hard work. And some good news for seniors is starting right away, that some help with the donut hole, the gap that seniors have in their health coverage, will start this summer. We're putting together the rules that will allow checks to be mailed as early as June of this year, and some information to seniors about what kind of choices they're going to have in the future marketplace, and that preventive care is now going to be covered without a copay, and a yearly physical for seniors will be covered as part of the Medicare plan. All issues that I think make not only good sense, that people have been talking about for a long time, but actually hopefully keep people healthier in the long run, not waiting until they get sick and end up in a hospital. We'd like to have a healthier population all the way through, and I think this is a very good deal.
That's great. Well, I want to thank you both for joining us, Secretary Sebelius, Kathleen Sebelius at HHS, and Heather Smith from Rock the Vote. And whether you're a grandparent, a parent, somebody who's getting this new benefit, there's lots in this new health reform bill for you, but we also know you have questions. So keep tuning here in at our web chats. Go to healthreform.gov and ask your questions. We're here to help. Thank you very much, and we'll see you next time. I'm Jenny Backus. Bye-bye.